By what age should an infant have doubled its birth weight? A. 9 months. B. 6 months. C. 12 months. D. 3 months. The answer is B. 6 months. An infant should have doubled its birth weight by the age of 6 months, and tripled its birth weight by the age of 12 months. Children who fail to reach these markers may be underweight due to a variety of factors such as underfeeding, metabolic disorder, or failure to thrive. Which of the following is not part of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, Diagnostic Criteria for Autism Spectrum Disorder, ASD? A. Hyper or hyporeactivity to sensory input or unusual interests in sensory aspects of the environment. B. Highly restricted, fixated interests that are abnormal in intensity or focus. C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. D. Stereotyped or repetitive motor movements, use of objects, or speech. The answer is C. Hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level. All of the behaviors listed are part of the diagnostic criteria for autism spectrum disorder except for disruptive hyperactivity impulsivity present for a period of greater than 6 months, which is part of the DSM-5's diagnostic criteria for attention deficit hyperactivity disorder, ADHD, not for autism spectrum disorder, ASD. A mother brings her 7-year-old daughter into the emergency room after she fell while riding her bike. She was not wearing a helmet and she hit her head on the asphalt. Which of the following is not a sign of late-stage increased intracranial pressure, ICP, in a pediatric patient? A. Dilated scalp veins. B. Bradycardia. C. Diminished level of consciousness. D. Fixed, dilated pupils. The answer is A. Dilated scalp veins. Diminished level of consciousness, bradycardia, and fixed and dilated pupils are all signs of later stage intracranial pressure, ICP. Dilated scalp veins may be present with ICP, but will be seen in the early stages of the condition. A nurse is instructing a parent on proper care for their 7-year-old son who has recently been diagnosed with a seizure disorder. In regards to care during a seizure, the nurse should advise the parent to do all of the following except dash. A. Note the length of the seizure. B. Place a padded tongue blade in the child's mouth. C. Stay with the child for the duration of the episode. D. Move furniture away. The answer is B. Place a padded tongue blade in the child's mouth. A parent of a child with a seizure disorder should be instructed to stay with the child through the duration of the seizure, to move any nearby furniture out of the way of the child to prevent trauma, and to note and record the length of the seizure. No object should ever be put into the mouth of a child who is having a seizure. Which of the following would increase suspicion of strabismus in a pediatric patient? A. The child does not respond to loud or sudden noises. B. Difficulty holding eye contact or responding to social cues. C. The child complains of frequent nausea. D. The child consistently squints or tilts head to see. The answer is D. The child consistently squints or tilts head to see. Strabismus is a misalignment of the eyes that results in one eye becoming dominant over the other. It does not affect hearing or ability to connect to others socially. This condition should not result in nausea. The nurse in the primary care clinic meets with a 22-month-old boy and his mother, who is concerned about his sleeping habits. He cannot sleep without a bottle of milk and wakes during the night to ask for more. What should the nurse tell the child's mother? A. Put juice in the bottle instead of milk. B. It is better for you to leave him with water instead of milk. C. Let him have one bottle of milk at bedtime, but do not give a second bottle. D. He can have a bottle of milk before bedtime, and you can give him another bottle when he asks. E. Do not let him have any bottles in the crib. The answer is B. It is better for you to leave him with water instead of milk. Babies and toddlers should not fall asleep with bottles full of milk or juice with them at bedtime. Plain water would be acceptable for a child to have at bedtime, as it does not have any sugar. The sugar in milk and juice will remain in the child's mouth during sleep and cause caries, even if the teeth are not fully formed. It is common for babies to lose interest in bottles at night time when water is substituted. The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. At what age should an infant show stranger anxiety? A. 2 to 4 months. B. 6 to 8 months. C. 8 to 12 months. D. 4 to 6 months. The answer is C. 8 to 12 months. An infant begins to show signs of anxiety toward strangers between 8 and 12 months of age and may recur until 2 years of age. This anxiety can show as silence, staring, writhing or crying in the presence of people they don't know. At what age does an infant develop the grasping response? A. 3 to 4 months. B. 6 to 8 months. C. 0 to 3 months. D. 4 to 6 months. The answer is C. 0 to 3 months. The grasping reflex is the earliest reflex developed by the infant. It is often present at birth. The infant will grasp at objects such as a finger placed into their open palm. At what age will an infant develop an inferior pincer grasp? A. 6 to 9 months. B. 4 to 5 months. C. 9 to 12 months. D. 2 to 4 months. The answer is A. 6 to 9 months. The inferior pincer grasp is the ability to pick up small objects such as by resting the forearm on a surface and pinching using the sides of the thumb and the index finger. It is an important milestone in the development of fine motor skills. Feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of what? A. Postpartum psychosis. B. Postpartum anxiety. C. Postpartum depression. D. All of these answers are correct. The answer is C. Postpartum depression. Feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of postpartum depression, a condition that affects as many as 4 out of 5 people after giving birth. Postpartum psychosis is a much more serious condition, involving delusions, extreme mood swings, and risk of self-harm. What is the cause of postpartum depression? A. An extreme drop in hormone levels. B. Specific vitamin deficiencies. C. Lack of sleep. D. Social stress. The answer is A. An extreme drop in hormone levels. While vitamin deficiencies, lack of sleep, and social stresses can all contribute to depressed mood after giving birth, the primary cause of postpartum depression is an extreme drop in hormones, primarily estrogen and progesterone, that occurs after delivery of the placenta. A first-time mother comes in 10 days after giving birth to a healthy daughter. She is concerned because she has been bleeding continuously from her vagina since labor. The blood is red to brown, and she has been using sanitary napkins, which she must change about every 3 hours. How do you counsel her? A. This is an emergency, refer to urgent care. B. This is normal bleeding as she expels the remains of the content of her uterus after labor. C. This is normal bleeding most likely due to the sudden drop in her progesterone levels. D. This bleeding is abnormal and may be signs of a mild uterine tear. The answer is B. This is normal bleeding as she expels the remains of the content of her uterus after labor. Postpartum bleeding, referred to as lochia, is a normal process wherein the individual sheds blood, mucus, and uterine tissue after delivery. This bleeding can continue for up to 6 weeks, and coloration can change from bright red blood, lochia rubra, to pinkish brown discharge, lochia serosa. A new mother comes in 2 weeks postpartum. She is complaining of left breast tenderness and heat. On Pu, note the slightly enlarged left breast that is mildly erythematous and very tender on palpation. This is most likely what condition? A. Fibrocystic breast disorder. B. Ductal carcinoma. C. Mastitis. D. Benign cyst. The answer is C. Mastitis. Mastitis is an inflammation of the breast tissue, often due to milk stasis in a breastfeeding individual and occurring most commonly in the first few weeks after delivery. Causes can include poor latching, tight bras or clothing, or infection. Incidence is higher in individuals who are immunocompromised, and in people with cracked nipples or past history of mastitis with a previous birth. Mastitis is not an emergency, nor is it any type of cancer, cyst, or serious breast disease. How long would the umbilical cord stump generally remain on a newborn? A. 4 weeks. B. 1 week. C. 2 to 3 weeks. D. 2 to 5 days. The answer is C. 2 to 3 weeks. The stump of the umbilical cord will generally remain for 2 to 3 weeks after delivery. During that time the stump's coloration will change from blue to black as it dries. Eventually it will fall off much like a healing scab, leaving behind the umbilicus, navel. The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. What is a normal hematocrit for a newborn? A. 45 to 65%. B. 60 to 80%. C. 35 to 40%. D. 50 to 75%. The answer is A. 45 to 65%. Normal hematocrit in a newborn is 45 to 65%. This is measured via heel stick just after delivery. This test is useful in assessing for anemia, suggested by a low hematocrit, and polycythemia, suggested by a hematocrit over 65%. Which of the following should be encouraged in a person presenting with mastitis? A. Go to urgent care if a high fever develops. B. Wear a loose-fitting bra. C. Breastfeed as much as possible. D. All of these are correct. The answer is D. All of these are correct. The most common treatment for mastitis is frequent breastfeeding, along with rest and loosening of any tight-fitting clothing. Most cases of mastitis are non-infectious and do not require antibiotics. However, high fever can be a sign of infectious mastitis, and may require pharmaceutical intervention. At what age does an infant learn object permanence? A. 6 to 8 months. B. 2 to 4 months. C. 3 to 5 months. D. 5 to 6 months. The answer is D. 5 to 6 months. Object permanence is the understanding that an object still exists even when it cannot be seen, heard, or touched. It is often tested by placing an object on a surface, then covering that object and allowing the infant to attempt to uncover it, thus demonstrating a knowledge that the object remains present though it is hidden. Which of the following is not a part of the Apgar score? A. Appearance. B. Respiration. C. Activity. D. Gurgling. The answer is D. Gurgling. The Apgar score is a test of newborn health and physical function, designed to assess a newborn for need of emergency assistance. The factors used to calculate the score are the following: appearance, pulse, grimace response, activity, respiration. Which of the following behaviors would be under the category grimace in the Apgar score? A. Coughing. B. Pulling away. C. Sneezing. D. All of these. The answer is D. All of these. The grimace category of the Apgar score actually refers to a wide variety of reflexive behavior. These include sneezing and coughing, crying on stimulation, pulling away, and facial expression. At what time after birth is the Apgar score calculated? A. At 1 minute only. B. At 1, 5, and 10 minutes. C. At 1 and 5 minutes. D. At 5 minutes only. The answer is C. At 1 and 5 minutes. The Apgar score is calculated 1 minute after birth, and then again at 5 minutes after birth. It is common for infants to be born with depressed respiration, cyanosis, and other physical signs of struggle that are quickly resolved within 5 minutes after birth. If signs of respiratory or cardiovascular distress do not improve by this time, however, emergency intervention may be required. You have just calculated a newborn's 5-minute Apgar score as 5. What is the proper response? A. Do nothing, this is a normal score. B. Emergency intervention, this is a severely depressed score. C. Do nothing, this is a perfect score. D. Monitor closely, this is a moderately depressed score. The answer is D. Monitor closely, this is a moderately depressed score. The Apgar scale goes from 0 to 10. A score of 0 to 3 would indicate severe depression of function, 4 to 6 would indicate moderate depression, and 7 to 10 would be a normal, healthy score. In the case of moderate depression, the newborn should be monitored closely. Immediate emergency intervention may not be required, as healthy neonates can have moderately low Apgar score indicators that improve in the first few hours of life. What is a normal heart rate for a newborn 2 hours postpartum? A. 110 to 160 beats per minute. B. 60 to 90 beats per minute. C. 140 to 190 beats per minute. D. 80 to 110 beats per minute. The answer is A. 110 to 160 beats per minute. A newborn's heart rate is significantly higher than that of an adult. Normal heart rate for a newborn 2 hours postpartum is 110 to 160 beats per minute. Heart rate decreases in the first year of life to 80-140 beats per minute. A nurse assists in the delivery of a healthy 7 pounds, 4 ounces infant. 6 days later the parents call the clinic with some concern. They state that their daughter has begun to lose weight. She has lost nearly 10 ounces since birth, despite breastfeeding regularly. How should the nurse counsel this couple? A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. B. This is an emergency. The couple should bring their infant to the emergency department. C. This is not normal but not yet a cause for concern. D. This is abnormal and cause for serious concern. The answer is A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. It is normal for infants to lose 5 to 10% of their birth weight in the first 7 days of their lives. In a healthy baby, this weight will be regained by the end of their second week. Infants who are born ill or premature may take longer to regain this weight. If an infant has passed the second week of life and it has not returned to or surpassed its birth weight, the family may need to seek lactation counseling or bring the infant in for further evaluation.